Do you have emails?
Yes. Here you go. Yeah. So what I do is always email them afterwards too. So if you want them directly, a certain one. Yeah, if you want to put down one for headache, so I'll email. Then you're good. Then I'll send you the last one's one with the headache. Yep, that's the one. Yep. Well, do also if you have any questions for me, let me know. I can email direct to someone else. Another workshop at the top also. So I have one thing for back pain, neck pain, headaches, shoulder pain, I think knee pain, posture, life. I don't know. If you have any questions, let me know. All right? Get some moving around here. So I'm going to walk through these first, the first couple, and we'll do overall the exercise afterwards too. All right? So we'll need demonstrators. So whoever wants to demonstrate, make sure you stretch your shoulders a little bit. Okay? Good? So the first one is, what are the muscles of the shoulder? Okay, what are the muscles of the shoulder? To talk about that, it's going to be, oh, you messed the camera up. Okay, you're good. No. When I talk about shoulder, is it just here? Is this your shoulder? Or is also, what's your shoulder? What do you consider a shoulder?
The whole thing?
The whole thing, right? When you say the whole thing, I go the whole thing as being the neck, the actual shoulder itself, shoulder joint out here, along with the upper back here, along with part of your upper muscles of your arm, along with part of your chest muscles. So I'm halfway down here, halfway down here, halfway down here, and then all of the neck. The reason is, when we talk about a shoulder motion or movement, you always want to go one joint beyond what it actually is. You want to make sure you cover one more joint. Okay, what I mean by that, if I'm moving my arm, it's not just this one muscle working, it's all the muscles, even the armpit muscles too, the lat muscles, helping it elevate and depress. So I want to look at everything together. Okay? How many muscles are there? You want to count? I don't know, 5, 6, 7. But when we talk about injury down the line, which we will in a second, we want to figure out where the problem is and what's the secondary muscle that controls that area. I call it more of a complex joint versus one joint or one muscle. Because it moves by different areas moving together. Even your neck moves, right? When neck moves, it's going to pull your upper trap muscle to make that whole area want to stretch itself out or stay tight. Any questions so far? Simple things. But look at whatever part you're looking at, maybe a knee or a shoulder, whatever it is. Look at the bigger picture versus just because your mechanics also, your movement patterns, how you stand, how you sit, affects recovery, affects even injury. If I'm sitting here, for example, sitting down, and my shoulder is rolling forward, what's going to happen? Now, all these muscles in the front, the pec minor, anterior delt, even part of the bicipital tendon here, all those muscles start to tighten up to make that your posture position. Your body will adapt to your structure. Are your bones in your spine harder, a harder material, denser material, or are your muscles more dense? What do you think? What's a harder material, muscles or bone?
Bone.
Bone, right? Okay, so if bone's harder, it's going to pull everything that way. If my bone structure is pulling forward already, it's going to make my whole body shift forward. And not just this side, but also the other side too. I saw someone this morning, ironically, because I'm in a shoulder problem. She's had a shoulder problem for over a year now, where her shoulder is tight. Now her muscle of her neck also, and her neck muscles here, have now tightened up to support the muscles. Support that joint space, that alignment, that shortening of the muscles. So now even your neck muscles, called the SCM and scalenes. Scalenes are here. If you ever take a Jeopardy, what muscle here is scalenes. Muscle comes around to the back of your neck, to your front of your neck, your clavicle, is your SCM muscle. At that point, when that shoulder tightens up, what happens is everything tightens up. So it makes your overall posture look more like this. So not only do you have the shoulder lifting, shoulder rotation forward, now you have the neck twisting down to support that tighter muscle here so it can relax. Okay, any questions about that? Look at someone and look at where the muscles are tight, what the problems are. Look at not only where the actual injury is, But how now is the posture? Has the posture shifted over time to make now the body head, shoulder level being off, and shoulder being rotated forward or backwards? Look at this big picture. Give me one second to check something real quick. Look at the big picture. You want to look someone, even yourself too, that I was talking to the patient about today. A lot of it is, how do we look at someone from the side view and the front view? Why do you think that is? Why two views? If the picture is one-dimensional, okay, how do we make something from two-dimensional, actually from one-dimensional to three-dimensional? You take the side view and the front view. At that point, we can put a mirror in our head, exactly the rotation components, how the body's being affected. Looking at static position, we can talk about now how the movement's been compensating or limited based on that different motion. That allows you now to release that pressure and helps them recover so they can perform the motion in full strength over time. Okay? Any questions so far? Is that over people's head or does that make sense? If I have an injury here, my shoulder's been there long enough, I'm going to check, has my body now guarded to make it tighter? Has my neck muscles now guarded to make it tighter on that one side? And has my overall even upper back now punched more forward to make me feel my body shifted? The problem is if you're here long enough, this feels normal to you. I did my patient this morning. She didn't know her neck was off, her shoulders were off, because that's been there long enough. Why do you think that is? Exactly. Your body, your mind will reset your default posture as this as your normal. You'll say, you're okay. Then you start having more pain, and more tightness, more nerve, even her sense more nerve pain down the arm. If we get things to reset, if we know what normal is, then we can set it back to a better normal position, and then now get muscles to stretch and move, make us want to get back to a better normal, what they call an optimal normal. Okay? Next thing, okay, is what causes injuries that are, when I say non-traumatic is going to be like, I fell on my shoulder. I threw a baseball and I hurt my shoulder. Okay? Things like that. That's traumatic. What's non-traumatic shoulder pain? Where does that come from, you think? Little by little, exactly. So it becomes more of an acute injury than a chronic injury, so now your body has adapted to make that your normal. Again, we talked about earlier, your position, your motion. Okay? So when it's non-traumatic, how would this position cause pain though? How would that make your shoulders sore? How would that make things more uncomfortable? How would it cause pain? How are you, ma'am? There's a spot right over there for you. Packed house today. So if our shoulders are here long enough, then what does my neck do? It tightens up over here. It can cause a neuropathy, where now on that side of your neck becomes shorter, so now the spine has to bend structurally. Now you can pinch the nerve. You have that, what you're going to have? Sometimes you'll have localized neck pain, headaches to the side of the head, hand tingling, numbness, or burning, or even pain in that fingers, and even shoulder pain too. So my job is to make sure I assess where the original problem is, maybe the neck and or shoulder combination, but if it's non-traumatic, it's been there for longer, it's happened over time, now the whole body is shifted, so now we have to not only take away the painful area, maybe the neck, or the headache, or the shoulder pain, but now get everything to change back to better position to normal, so a one-dimensional view from the side view, from the front view, gets back to better position over time. Any questions about that? Yes.
Question. In January, I actually was doing exercise and I fell out of bed. And you just brought it to my attention. And of
Yes.
course, I went to the doctor. And I'm left-handed. So yesterday, I had this pain starting from here all the way down. And I just thought it was like inflammation, you know,
Yes.
and I started taking Tylenol. But you brought it to my attention back in January where...
But what happened was you had a trauma, but it was never corrected or looked at in deep enough, so things would happen on your left-hand side, exactly, things probably tightened up either the neck or the shoulder or the muscles, now that time to actually sit there and pinch. Okay? So non-traumatic pain can also be a post-accident case or whiplash from a car accident. Who's ever been in a car accident? Me? Everyone's ever been in a car accident before? Most people, if you're in California, it's going to happen. Okay? If I have a whiplash, it can even be 10 miles an hour, it can cause the neck to tighten up to make that nerve want to fire. And fire down the arm, down the back, or in the head is more commonly happens. When you have that, then you're going to even have part of that neck nerve that comes from the neck here. It's called cerebrobrachial plexus. Again, if you go on Jeopardy, you'll hear that word. That's when these nerves come down. These form a branch called the axillary branch. That's your shoulder branch right in your shoulder. A nerve ending, is it sensitive? Just say yes.
Yes.
Okay? Most of my questions will be yes answers. Most of them just to give you a heads up. Here's what I do. Okay? So if a nerve ending is sensitive, someone may have, yeah, my neck hurts a little bit, but my shoulder hurts a lot. So I go, okay, what's going on? Where's the limitation? Yes.
I had a stroke 5 years ago.
Yep. Mhm.
Okay, but this side of the brain, I guess this is the side that is smaller than this side.
Mhm.
But I noticed that I get, I put my rings on, it's bigger, and I get a lot of pain here, in the shoulder. And then if I exercise, it goes away a little bit.
Good. So when someone has a stroke or an injury like that, non-traumatic again, okay, falls in that category, and then if we cause more motion, at that point now we cause the nerves to relax, now we cause more blood flow, everything wants to be a better state of health. So you read my talk, I think, from last couple of years ago,
Yes.
in the sense where if you cause more motion in your spine and in your body can heal faster. Your body can heal faster. Your left arm, and this will go away. Okay? But it takes the know-how of what to stretch and where to stretch. Once we know there's no major injuries going on, like someone who had a stroke, okay, let's make sure medically they're fine. Make sure structurally there's nothing in your neck that if I was to adjust the neck would cause more motion, would make it worse. I had someone come in, she has Parkinson's, came in last week, bad Parkinson's, and she tried some stretches and made it worse. So it's doing enough, it's doing enough to help things get better, but overdoing it. You're not going to know until you know what's going on with the structure first. So I make sure everything's safe to do your exercise when you start doing your exercises.
But I can have another stroke according to what.
It can happen, but can we cause more motion to limit the ability so things can actually move better?
Okay.
That's the biggest thing.
But it's
Keep
got
moving.
nothing to do with my sleeping on this side.
Because you're not moving enough when you're sleeping? Good. Again, she's read all my notes already. She's a planted person in my audience today. Okay? In the sense where if we're sleeping, are we moving? This is a no answer, sorry guys. Screw you guys off. Okay? So if we're not moving when we're sleeping, at that point it can tighten up. You get tighter around the nerve root, causing neuropathy down the arm, and or pain, and or burning, tingling, or numbness, and cause headaches too. So one of my questions I ask my patient when they come in for the first time or for a new injury, I go, do you get it more when you sleep or when you wake up in the morning? That tells me something's locked up in their spine, not moving properly. We have to move that to get things to improve. Make sure those muscles on that side will stretch, get things moving more. But the movement is the key, yes.
What would be the best way? Because I move a lot.
Yes.
And I move, all night.
Uh-huh.
And I move tobacco. But in the morning, I always have a migraine headache. And maybe it has to do how, and I cannot find the correct, because I put my hand here, put my hand here. I mean,
Well, the problem is because we're moving, when we're sleeping, we're moving, or in your sense, moving maybe too much. Then our neck can get twisted to pinch a nerve too. Causing migraines, causing headaches, causing vertigo. Can cause all that stuff. So it's understanding, okay, if I can sleep a certain way, I may start there, but if I'm going to naturally move all night long, or I'm a natural side sleeper, or back sleeper, or even stomach sleeper, then I got to go, okay, how do I make sure I at least start where I want to start, and then I can put a pillow somewhere so I don't move too much. So for yours, what I would do, excuse me, is I would actually put two pillows on my side, so at least my body's not going to turn as much. You limit your side, at least your body motion. Allow that not to move. But if we're moving so much throughout the night, we're not going to know what's going to happen. Unless you want to videotape yourself sleeping, which is weird. At that point, you want to make sure you're doing enough not to move. At that point, you can twist your neck here, 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 and not know what's going on. But migraines are a sign of neck injuries along with head injuries too, along with neck nerve injuries. Yes?
But I have multiple myeloma.
Yep.
And I sometimes wonder if that has to do with my bones.
I'd say not as related as you think. But again, to keep things very simple, if you can cause more motion even with a stroke, not only does it improve the neuropathy or the nerves regeneration, so the nerves work better, but along with the blood flow and joint instruction.
But I'm in remission. It's
Yeah,
not
so
curable.
keep moving more.
Yeah, that's what I keep
And
doing.
you have been, that's what you do. You're doing everything right, just keep doing it, don't overthink it. What I do every day, my job, right? Okay, next part. What is a sign of a shoulder problem? It can be pain, can be other stuff going on too. What's a normal sign, you think? What do people normally have? Yes. I can go here, doctor, but I can't go past here. I can, sometimes they go, I can't lift my arm. Okay, we gotta figure this one out. But I go, can you do this? Can you move your hand in and out? Can you supinate, pronate your hand? So I go, what can we do? That tells me here, okay, you know it's not an elbow problem. You know the wrist, and I go, can you move your hand okay? Good, so we know not a wrist problem. So the shoulder's gonna be, this basic motion is for the shoulder to test your motion. Can we go out this way? Good. We go in, good. We can bring the elbow up. Good. We bring the elbow back. Okay, maybe limit it there a little bit. That's usually a common area with limits. Doesn't make that want to stretch even more. But then we go from here. At that point, we tested rotation of the shoulder. The shoulder joint is a ball and socket, right? So the shoulder joint itself is a ball and the socket. So can it move in different directions without causing injury? The problem is that ball and socket is surrounded by tight ligaments and muscles. Ligaments underneath, muscles on top, make things not want to move or become unstable. So by doing these motions, we're testing which ligaments, which muscles are limited causing problems. Bless you. To get that limitation reduced over time, yes, with stretching, with movement. We have to make sure we unwind that shoulder to make it better. The common area where the shoulder gets stuck is going to be forward and internal rotation. Okay? So if we have this position where it's stuck this way or wound up in and also down, now we have to unwind it which way? Back and out. So we want to make sure we get the shoulder out here as much as possible, full range of motion. And also too, stronger, not just range of motion, right? This requires your shoulder to activate along with the upper trap, along with part of your anterior delt muscle in the front, along with your posterior delt too. About 4 muscles, even 5 almost, help elevate the shoulder in forward position. So make sure all those muscles are working properly. If I have to do this, okay, it hurts. Where does it hurt? Does it hurt here from the shoulder where it's more medial delt? Hurt in the front, in the side, or in the neck, or the upper back? So I want to know exactly where you pinpoint the pain. Sometimes someone will strain the muscle. Okay, good. Strain the muscle, take care of the muscle, you're good. So if it's been there for a long time, what's causing it to become sore? When there's so many muscles and areas involved, it takes more work to tell exactly what the problem might be. If it's an elbow, there's 2 joints. I'm sorry, 2 joints, 3 joints. Easy to diagnose. When there's a bunch, it's got 7 muscles, about 3 joints involved besides this joints too, then you worry about, okay, which one can it be? It'd be more like a Sherlock Holmes for that one. All right? Any questions yet? Questions? Nothing? And other concerns about shoulder, who's ever had shoulder pain? Me too. Me too. Okay? I tore mine before bench pressing.
What about neck pain?
That's coming from your shoulder. It's good. So when you have shoulder pain, what happens is it tightens up, then it makes that upper trap muscle, which is attached from your AC joint of your shoulder, down through your upper back, down here, and over to your neck. It's like a triangle. I don't have any markers today. It's like a triangle of muscles from your shoulder, neck, upper back. Okay? When you have that, if you hurt your shoulder, just your shoulder, what's going to happen is, now the nerve wants to fire, causing pain. That pain makes your body do this. Oh. Makes everything tighten up in that neck. So if those muscles here attach to the neck, it'll make the neck tighten up too. So again, we'll look at not only the problem of here, the shoulder, but also the areas above and below that area. All right? Questions? Just stretching? Good? So now, let's get into the meat of the talk. How do we exercise? How do we get the shoulder if more than not it's commonly rotated in from an injury, non-traumatic or traumatic, and also, down and also in, how do we get that to open itself up? We talked about the things that go from in and down to out and up, right? So number one is a complicated one, so make sure you guys pay attention. I'll repeat it only once, maybe twice. 3 times really ask me, that'll be nice. Okay? So here, is that good? That's pretty good. If I'm on my bed, that's good enough. I like a harder surface like a floor or a mat like this one. Don't take this one because it's mine. Some other one if you may have it at home. If I have a left shoulder problem, a little bit more can see me than people, the viewers at home. Here, and I take my left shoulder, I may feel I can only go out to here so far. I may feel comfortable, painful, or sore. Okay? Another note too. When you stretch, taking a step back, should you feel pain when you're stretching? Do you feel pain when you stretch? Just say this is another no, I'm sorry. I have to change my questions around. Okay, we want to say no to this one. Okay? When you stretch, you want to make sure it feels uncomfortable, a little tight, but not painful. The reason is when it's painful, it guard tightens even more. It's going to fight you. So wherever you're doing a stretch, it may make you make a face like you're going to squint because it's uncomfortable. Okay, we want it there. So when I do this stretch, I'm going to use a water bottle to start. Some people might be too much, we'll see. I'm going to take this water bottle. I'm going to start with someone who's in shoulder pain. Bring that shoulder, bring that hand out as far as to where they feel uncomfortable. It might just be here. It might go all the way. Depends how much range of motion they have. More range of motion, better improvement over time. So if I have that, and they can go just about here, I'm going to go hold that for about 30 seconds where it's uncomfortable. Why do you want to hold the stretch? Give the muscle ligaments time to actually stretch. We're not trying to strengthen the muscle. We're not trying to kind of contraction back and forth. We want to make sure you give it time to actually move and hold that stretch. Your muscle has filaments like a string, has to be pulled so it stays a longer muscle or ligament, doesn't want to become tight over time. Okay? So you want to hold that out where it's uncomfortable. If that feels good, go a little further. Feels good a little further. Maybe 2-3 times at the most. You come out, hold 30 seconds, relax, go a little bit more. That feels good. Then, as you're comfortable, then creep the elbow up, out a little bit more. Maybe if it's possible, halfway up to 45 degrees. At that point now, let that shoulder drop down. The reason is, as you go further out, because the secondary motion in the neck and the shoulder kind of become even tighter. Let's make it looser, not tighter. So I'm going to come out here. Feels good. 30 seconds here, if it's good. Then 30 seconds a little bit more. Any questions so far? I can't see your hand, so yell at me if you need to. Questions? Good? Good?
Over here.
Yes.
Did you
Always
raise your
picking on
hand?
your
He
friend.
said raise your hands to stretch. Oh.
There you go. Stretch away, stretch away. We want to do things slow because we want to make sure if we do too much, it might be sore tomorrow. Give yourself time, right? There's anyone doing bodybuilding shows? Bodybuilding shows? Anybody? There's no rush, right? Give yourself time to stretch. It feels uncomfortable, yeah. So see how it feels tomorrow before you go overdo it. Give yourself time to get there. Okay? If I've gone here now, and this feels good, by coming back at 45 degrees, with the elbow coming away from the body, what I'm going to do is now go maybe 90 degrees, as far as you can up, and now bring that water bottle back behind you to rotate the shoulders back and up as much as possible. Okay? Any questions about this? Good?
Good.
All right. Woo. Yes.
I was just practicing.
Okay, good. Practicing, stretching, do your thing. That thing is, can we move things enough and slow enough so we don't have to hurt ourselves? When I tore my shoulder back in 2000, it took me about 9 months to recover. It wasn't very quick, okay? It took a while, but I had to learn at what point am I overstretching it and what point am I doing it good for my shoulder. What I found, and what works for most people, is if you're trying to stretch more even strength than 2, it may get a little sore, okay? If it's injured where you want to take it, if not injured, but if you've done too much, overdid it, you're going to feel tender in the shoulder, or the muscles wherever you're going to be. It might be a little swollen too. The recommend people do, if you're trying to stretch or strengthen your shoulders, or any part of your body too, always ice afterwards. Why ice versus heat, you think? Why ice?
Reduce inflammation.
Go ahead, one more time. One time.
Increases the swelling, it sends it back to the heart.
Brings the swelling down, inflammation down. If I've made the muscle stretch too much, it's going to cause micro tears. If I tear a muscle, it's going to cause inflammation, cause swelling. Get that out of there by the ice pack. All right, you guys are too young for heat. That's for old people. Okay? Let's get the joke. Some people don't.
I missed it.
Next time. You'll watch the video later. The next one's a corner stretch. I have a corner. I have one over there. I'll show you guys right here. I need a corner for this one. It's called a corner stretch. So here, I'll put it there for now. You guys will see it in a second. I'll do it over here in a second too, but I'll do it over here. If you do corner stretch, you need what? A corner. Good, making sure you guys know that. I'm going to do corner stretch. What I want to do, I want to have my hands about parallel with my shoulders. You want to have them straight out this way. You don't want to go too low or too high. You want them right parallel with your shoulders right here. Okay? This thing, you also want to keep your head up the whole time. A lot of people will drop their head. I tell them you got to get your head up. Because you want to do, if you don't exercise in good position, good posture, maintain that position. So what I'll do now, I'm going to take that wall right here. I'm going to hold it, hands level with my shoulders, put one foot into the wall, one foot out. I'm going to let my body glide in, slide in, hold that position. Okay? The reason is I want all these muscles up front here to stretch. Move. So I'll show you up front. Any questions about the corner stretch though? About how to hold the corner stretch? I'll show on the board right now, but again, just to repeat, hand shoulder height in the corner, 1 foot forward, everybody slide forward the head up and hold that position for about 5 seconds and relax that position. Okay, so let's go back over here. I'll show you up here on the board too, so you have it on the board too. Okay, if I leave this here, ladies? Is that okay if I leave it right here? Are good? Right here, I'm going to go a little higher too. Here, and we'll go here. So here, if I'm in a corner, again, I want to do is a couple things. I want to make sure my hands in position, level my shoulders, hands here, head up the whole time, 1 foot forward into the wall, the body glide in. So you feel, what are you going to feel? You're going to feel all these muscles here open up on both sides. So if I have a tight left shoulder, is my right side going to be tight too? It might be, but maybe not as much as the right, as the left, I'm sorry. It'll feel uneven. So you're going to have a tighter and a not as tight side. Okay? So realize when you have that, try not to lean into the wall one side. Make sure both shoulders go in even. So if you get a little tight or comfortable, little pain, stop and go back a little bit more. Any questions about that?
Yes.
Yes.
Does this help your posture also?
Yes. Oh, yes, you read my notes. Perfect. My other notes. So if my head's up here and I'm doing the stretch this way, at that point I'm getting my whole body here to stay back here instead of here. We should be uncomfortable here. Not I'll yell at you. All right? So you want to make sure our body is staying here the whole time. If we're going to do exercises, make sure your body, and we did this before too, hard this little thing right here, but we go against the wall to check your posture would be heels, hips, shoulders, and head are staying here, not here. That's the key. If we have problems with weakness in our legs or our back, whatever it might be, it can take some time. But if you're uncomfortable here where it's too uncomfortable, go forward a little bit, but make sure when we're off the wall, we're standing or walking, the weight's on your heels the whole time, not on your toes. Because when your toes, we're doing what? We're hunching forward. Stay back in the heels as much as possible. If you get one thing from the stop, you get our posture change over time. All right? Any other questions or comments or the other notes we talked about before? So broomstick stretch, yes?
You mentioned vertigo.
Yes.
Is there a difference between describing vertigo and dizzy?
Good. Vertigo is going to be more of everything's spinning, even with your eyes open or eyes closed.
Okay.
Doesn't matter what you do, it's going to spin. Dizziness is more of There's no other, I might be dizzy, but there's nothing spinning in the room. The spins is what causes the biggest change is vertigo. Dizziness is more manageable. Vertigo is like you guys got to get yourself either whatever is causing the sensitivity in vertigo to make you keep that going. It's going to a dark room. It's turning off the sound, whatever it is, to get your body to relax. The vertigo too would be putting ice pack at the back of your neck to calm the nerves down even too. Combination of both. But again, vertigo versus dizziness. So I want to make sure we're looking at differences. Vertigo is going to be like the room spins no matter what you do, eyes open, eyes closed. Dizziness is more manageable. It's not a spin. It's more of your body just feel like it's shaking. Or your eyes, your vision feels like it's more shaking.
So if you lay down and everything turns black and it's spinning?
That's vertigo.
Okay.
So you want to make sure if you're spinning on you and you're lying down, make sure you put an ice pack on your neck. The best thing is keep your eyes open so you focus on something that's not moving.
Okay.
That's the one thing people don't, it doesn't feel natural. Focus on something that's not moving. At that point, it'll slow it down faster with vertigo. Like an ice pack on the back of your neck.
Is the muscles or tendons connected to why you have vertigo? Or?
You have vertigo because you have a combination of both nerves in your neck and your head causing you to become oversensitive, but also your inner ear can cause that too, because that's where a lot of your balance, your vestibular glands in your ears will cause it to become thrown off too. So a combination of both. The biggest thing is making sure it's diagnosed properly. Your ENT doctor will diagnose some of that nerve stuff too. The success rate with migraine headaches or vertigo is about 70%. 7 out of 10 people get better with chiropractic care.
With what?
Chiropractic care. As a chiropractor, yeah. We help people get through that. That's part of it.
With the migraine?
With the migraines and vertigo.
Okay.
Combination of both. What we do in our office, basically do a trial treatment with someone who has vertigo or migraines or dizziness too, about 2 weeks of care. You have 2 weeks of care, we can see where things are we seeing improvement? Are we on the right track? We want to make sure we're not wasting someone's time. You'll know in 2 weeks if you're getting better or not. Takes about 2 weeks. Make sure.
So if your head is in a certain position, is there anything you need to do with the muscles to prevent the vertigo? Or?
It's tough. It's tough. If it's neurological, we treat the neck to get that nerve component calmed down. If we're icing it though, we want to make sure we ice straight backwards with our head not bent to side left or right, just more straight. Part of it. All right? Next one is always a fun one to demonstrate. Or move involved. Yes?
I have to go, but
Go.
I thank you so
Welcome.
very much.
Of course. You keep up your good work though. Keep up your good work.
No, I'll be
Keep
doing
moving.
that because I need to do that.
Yes.
But thank you so much.
Don't ever stop. We'll see you next month. Keep doing well. So broomstick stretch. Okay? Complicated one. Take a broomstick. Can be a Swiffer. Can be a PVC pipe. Not a heavy pipe because heavy pipes are like heavy. But here, take something that has is not flexible. Take it and go back over your head. Anyone? Travis? Anybody?
That works. No,
It's-
with nothing, yeah, you can do it.
Good.
With
So
that,
modification, modification is now take it up, again where it feels uncomfortable. We talked about what that is, uncomfortable. Hold for about 5 seconds, then come back down again. And do it about 5 times. When I tore my shoulder, I'd do this for at least maybe a year. It took me about 3 days on my head. It took me 3 days on my head like a resurrection, 3 days. And it was like painful. But when you work on it every day, I tell my young intern patients, do them on the days that end with Y. It takes them a while, like, what day do I not do it on? All of them, do them all of them. That one allows your body to get looser and stronger over time. Okay? What you've seen so far are stretches. The shoulder stretch, 90 degree, I call it 90 degree shoulder stretch. The corner stretch, now this one too. We always want to stretch first and then strengthen. We always want to increase range of motion first and then strengthen. What happens is if I'm working out here, getting stronger here, I'm locking this in, not good posture, good position, good range of motion. So come up, let's see. Let's try. Coming up, Miss St. Patrick's Day.
Yes, it is.
Yes. 1 day away. If you're in, I think in Europe it might be tomorrow, I'm not sure yet.
It is in Australia.
See, you know your geography. So here, wide as you can to start, we'll stand up straight, we'll come all the way back. This again, where you feel comfortable. Try to keep the bar straight. All the way over. Very edge. There we go.
Okay,
Come
now
on back.
up,
Yep.
up.
There we go. Good. So as you can see, the side's a little tighter. Come all the way back.
Yeah, that whole side is tight all the way to the head.
Good. So we're going to come back again one more time.
Okay.
Come back
Up.
and hold right a little bit further back. There. That's your starting point.
Okay.
Once you go here, now we start to bend. That's not going to be good.
So now, you mean this way?
So you want to come all the way down. I'll keep your elbows straight. Now come down. Now it's hard to do.
Yes.
We're going to come up here until that. So stay right there. Now bring the elbows back this way. There we go.
Thank you.
Here, there we go. So that's your starting point now.
I think my
Once that's
belly
comfortable,
should-
and then over time it will cause more of the stretch as you get better and better.
Okay.
But we don't want to do, I'm going to show you something real quick too.
Mm-hmm.
When people will cheat, which is common because it feels easier, they'll come up and come down this way.
Is that what?
Fail. You're close, you can do that though, you can do that though. But rather you come up here, elbows stay locked,
Mhm.
hold, stop there, versus this, 'cause that's cheating. That's illegal in some countries. All right? So what it is, come back, hold that where it feels uncomfortable. Once you feel you have to drop, just hold it there for 5 seconds, and then come back forward. Try one more time.
Oh, gosh, let me see. Here,
Yes, you're
clear?
doing fine.
Okay, you go up.
Yep. All the way up. Up, 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 up. And hold it right there so you don't drop. 1, 2, 3, 4, 4.5, 4 3/4, 5. And forward. Boom. That's your starting point. Okay?
And
So you
then-
don't roll back.
Okay.
Good.
So what do you mean now, roll back?
So you don't come down here. Keep your arch the whole time.
Oh, okay.
There we go. Yes, you're there.
All right.
You got it. That's the thing is, maintain the arch the whole way. Good work. Golf clap. Good job, good job. Maintain the arch the whole way. Don't let those arms drop all the way up. Okay? Again, give yourself time. Always start as wide as you can on a broomstick, Swiffer, PVC pipe, whatever you want to use. But make sure it's a hard, because when it's hard material like this, then your upper back too, back here, that back of the shoulder gets the full stretch also. If I cheat and do this, now there's no tension, now that shoulder isn't being stretched. This allows tension by having a solid stick. Yes, ma'am?
Question, is that important, the weight of the bar?
Light as possible. Light as possible. Light as possible. Allows your body to stretch, not strengthen, just stretch for now. Then line we'll add some weight, but not yet. All right? Any questions yet? All right. Now I have modified shoulder press. This is kind of it's not a hard one, but it'll test everything. Oh my gosh, grab it. There we go. I do this one seated because it's easier to see. Standing is fine also. You want to, like we talked about before, you want to make sure we're sitting up, not like this, you want to make sure we're sitting up as far back as you can in the chair. Okay? This is a 3 shoulder exercise. I do, in my video I have my patients standing because I do use a wall. We'll just see it here, it'll be easier. Okay? First one, 3 shoulder exercise says how many, it's a 3 shoulder exercise video. How many exercises do you think in the video?
3.
Yes, you guys are awake, perfect. So number 1, elbows tucked in, we're gonna come straight out. Okay? We're not gonna do this. I'm good, Doc, it feels fine, yeah, because you're not doing it right. Again, fail. Elbows tucked in, go back, go out as far as you can where the elbows want to start popping out, but hold that position. Elbows tucked in the whole time, elbows tucked in the whole time. Then bring the hands up. Good. All right, feel okay? So the second one, this is going to be here, so what I have patients do, come out, hold for a second, then come back in. Hold for a second, then come back in. About 5 times to start. Okay, that's number 1. Number 2, again seated, is elbows shoulder height here, hands straight out. So your elbow and hand should be at 90 degrees, coming straight out the whole time. And from there, we're going to come, without moving the elbows do not do this, we're not going to fly away. We're going to come straight up, we're going to hold, and then come back down again. Good again, come up. Fantastic. And then come back. So want to make sure our elbows stay here, they don't drop. Ah, you'll get it, you'll get it. Elbows here, come up, hold, and then drop. Okay? So it's hard, it's not easy. If it was easy, you'd be perfect. No, you're not perfect, neither am I. That's my wife, I'm like way down here for perfect. That's my wife. Okay? Next one. This is a standing one. I'm gonna say this chair, back of the chair is the wall. I want to hit this thing over here, I'm gonna break this thing. You want to go against the wall with your hips, but you want to have your feet out a little bit. Okay? Because you're gonna bend over forward just about maybe 10 degrees. The reason is I want to make sure we have the water bottles up front. Thumbs pointing forward for number 3 of the shoulder tree exercises. What you do is come straight up, hold, and come straight down. Okay, so we're going to come here. Elbows this time straight, not bent. Elbows straight. Water bottles pointing forward. Thumbs pointing forward. And come up. Again, head up. I missed this one. Head up, come up, hold, and then drop the hands. This one I want you to feel for this one. The back of your neck should feel tighter. Okay, when you come up, the back of the neck should feel like it's pinching. Fantastic. You want to work all the muscles. This exercise should make these muscles in your spine, next to your spine, your rhomboids, that connect to your shoulder, right, on both sides, make them move. So if I'm doing this one, the first one, here, I'm facing the wall this time, but I should be facing away from the wall. You're going to see my back, hopefully, because it didn't work out today. Here, come in, pinch the blades together, then come out. People do this, or they'll do this, here. I'm like, no. Let's get the blade muscles to move back here, or bringing the hands out. Blades come in, pinch, and then relax. So make sure back here is pinching when the hands come out. Make sure that back is really moving more to make your body again, your body here, so that whole shoulder blade is moving with the motion. Any questions about that? And second one too, same thing here. If I'm doing this, what's moving? That whole shoulder joint, when I bring my hands up over my head this way, my whole shoulder's going to be able to move and unwind backwards, not stay forward. That's almost hard to do without moving the muscle. Have to move the muscle. All right? Any questions? I'm worn out. That's a lot of work. Worn out today. Anything? So a takeaway for this one is check your range of motion. If you can do this, you're about 90% there. If you can come back here and do this, you're 90% there. If you want to increase your range of motion, use a broomstick. Go real slow. Again, go slow, come up. Stand up here, go slow, hold, don't drop. Where it feels uncomfortable, tight, hold for 5 seconds, then come forward. If you want to really strengthen your shoulders and help your neck and upper back and your posture, then do the water bottle stretch. You come all the way this way, and especially this one. I have people that come in my office, they can be any age here, any age at all, and they have weak upper traps. Okay? Very weak. So if they're weak, it attaches to your shoulder and your neck. That'll cause shoulder pain, neck pain, and headaches. So my job, once the joint motion is normal, I want to make that stronger. Okay? How I get it stronger is this exercise, the last one. The modified shoulder press, again, see because it's easier to see. At that point, a shoulder press is bringing that hand above your shoulders. Okay? Modified is now bringing your hands, instead of being here, bring your hands facing your palms facing forward, now coming up this way. We want to make sure our hands, if possible, and our arms are going to be 90 degrees to our body. So our elbows and wrists should be parallel with our body, coming straight up, if possible, and coming straight down. A very simple motion, so position is the key. So palm facing forward, if possible, your wrist being parallel with your body up here, then coming straight up, hold, then coming straight down. Okay, the reason is you want to make sure everything back here is then moving in, but also now you're working the upper trap muscle to make them stronger also, along with the shoulder itself. So again, the last two, the 3 shoulders and the modified shoulder press is your strength exercise, right? Why do we do strength last? Why is that? We want to make sure the range of motion is good first, and then we want to load more weight to make our body stronger. When we're stronger, why is strength important?
Get around with it.
Get around, we can do our normal daily lives, quality of life. Also endurance too. I may feel good by, say the first couple hours a day, but if I'm tired and weak at the end of the day, I'm not strong enough. I have to build more muscle mass. So again, the shoulder press, want to be here. Hands parallel with your body along with your wrist. Hands pointing forward, coming straight up, coming straight down. When you come up, you want to do is hold for a second up, hold for a second down, repeat 5 times. And again, water bottles, start with them. Who doesn't have water bottles at home? No one raised their hand, good job, good job. Okay? And that's the thing is you want to start small, simple, and then build on top of it. But if you just do these 5 exercises, you'll have a looser and a stronger shoulder with good posture, so you'll look good and feel good. Walk around this all day. What's going on? How are you doing?
Yeah.
What's up? You know? You'll have more energy. I don't know.
Yeah.
Any questions at all? Any questions, let me know. Like I said, if you're not on my newsletter already, I want to do is email these out to you directly if need be. If you want something specific about this, let me know too. Again, it's all free. Internet's free. The phone calls are free now too. Remember, was it 10 years ago? I have someone roll over minutes, and all of a sudden I'm paying $10 a minute, whatever it is. Ugh, ridiculous. Anything else? What's next month? What's next month's talk? What's it say for next month? Give me 1 second. What's the next one?
Choices for energy
Ooh.
and weight loss.
Food choices for energy and weight loss. Who needs that? Me. I'll find out for you guys though before next month, all right? Thank you guys.